The honourable member for Edmonton Centre.
Well, thank you, Mr. Speaker. It's an honour to have the opportunity to rise in the House and participate here in this debate today on a very important and crucial issue. I, too, would like to acknowledge the families that have joined us here today. I appreciate that you've come here to share some of your story and recognize some of your own pain in trying to seek that this does not happen to other families in our province. And I honour you for joining us and being part of this here today. I first had the opportunity to meet families and friends of people who had died from overdoses at the International Overdose Day here in Edmonton back in August of 2015. It was my honor to speak on behalf of the government as part of that. There I saw many people who had had the opportunity to start to meet first back in just shortly after my election in 2015 when I had the opportunity to tour Boyle Street Community Services, a truly amazing social agency operating right here in Edmonton Centre. And on that tour, I met Marlis Taylor, a nurse and community advocate for who over 20 years in Edmonton here has been running the StreetWorks program. Now, StreetWorks' original goal was to combat HIV, but over time they expanded their work and they became the first organization in Canada to equip workers with naloxone kits. But all along, the principle that StreetWorks has been committed to has been the principle of harm reduction. The recognition that substance use is a chronic medical issue, that it's not a moral issue, but a medical condition, one that touches almost every family in every community in our province. Members today have spoken of the need to remove the stigma around substance use. I absolutely agree. It's regrettable that in past years, some politicians, including some, I think, past federal politicians, have failed to do that. They took actions which furthered the stigmatization and which prevented the implementation of important services that could be saving lives. Now, harm reduction focuses on practical strategies that work to reduce the negative consequences associated with substance abuse, allowing workers to build relationships of trust with those who are suffering from substance use, so that they can help them address the root causes and the drivers of their substance use and begin to help them on the difficult road to recovery. So after having met Marlis, I was very happy a short while later to be able to have the opportunity to introduce her, or to bring up her name with Minister Hoffman. Pardon me, with the member for Edmonton-Glenora. I apologize. The Minister of Health, member for Edmonton-Glenora. I was the opportunity to help connect Marlis with her and overjoyed when in October of 2015, Marlis was appointed to the Board of Alberta Health Services, bringing a strong voice to advocate for those suffering from substance abuse. That same month, I had the opportunity to meet with Marlis and fellow members of a group called AMSIS, Access to Medical Supervised Injection Sites Edmonton, at my office. They shared with me their proposal to embed safe consumption services in existing community agencies here in Edmonton. And they explained how these sites could help to combat the incredible costs that substance use visit on individuals, families, and our healthcare system. And how safe consumption sites could drastically reduce those effects by greatly reducing substance users' likelihood of overdose, by reducing their exposure to criminals, by reducing their need to commit criminal acts, reducing the spread of infectious diseases, and reducing the stigma and isolation of substance use. A crucial step in addressing its root causes and helping users on the road to recovery. Now, being familiar with the incredible results that have been seen through similar work at Vancouver's Insight Clinic, I was very excited by AMSIS's proposal. I made every effort to give them the opportunity to connect with our government, and in February of 2016, I had the honor of bringing them in to share their proposal with some of our fellow MLAs and the Associate Minister of Health. And last October, I was incredibly proud to see the minister announce funding of $230,000 to support AMSIS in engaging our local communities as part of their application for a federal exemption to operate those sites here in Edmonton, as well as another $500,000 to help other communities conduct needs assessments for safe consumption services in their areas. Mr. Speaker, there is overwhelming evidence that these service sites save lives, providing users with social support, medical care, and the opportunity to live long enough to make better choices. They also provide a vital on-ramp for the wraparound services that can change people's lives. Mr. Speaker, I also note that AMSIS began developing their proposal over 5 years ago. They were unsuccessful in getting any support from previous governments. They were unable to get support to move these projects forward. It's been 4 months since we announced our support, and to the best of my knowledge, I've heard nothing from the official opposition or the third party. Now, I recognize that our previous Prime Minister and some federal politicians that our opposition continues to vocally support went out of their way to make these important scientifically proven life-saving interventions next to impossible to provide.
That happened.
But it's my sincere hope that members on all sides of this House will have the courage to take a clear stand in support of these crucial investments.
Hear, hear.
Because saving lives is far more important than trying to preserve or burnish our political reputations. Investing in harm reduction and specifically safe consumption sites, alongside opioid replacement therapy, needle exchanges, and additional treatment beds, which we have invested in and continue to invest in. This is one of the most effective tools we have to address the challenges posed by fentanyl and opioid use. I recognize, Mr. Speaker, that the initial sites that are proposed are within the downtown core and are targeted at those who have the most need. I recognize that we need to see more of these sites, and I look forward to seeing this federal process go forward. I look forward to hopefully AMSIS receiving the federal exemption so that they can start these sites, we can prove their efficacy, and see more of these sites open up throughout our province, around our city. Because we know when people use alone, they're at their most dangerous. When we provide them with safe places where they can get support, away from stigma, we have the opportunity to save lives, help connect people with services and supports that can help them make better choices. I appreciate the concern that's been brought forward by members on all sides of this House today. I recognize the desire to want to do something publicly to declare support. I agree, we need to work to remove that stigma, work to bring this out more to the public, and we can do that. We are doing that here today. I've been doing that since I was elected to this office. I was very pleased to see at the International Overdose Day last year that Verna Yu of Alberta Health Services was there to speak and indicate their support for harm reduction and addressing these problems here in our province. Mr. Speaker, I have not heard anything today that requires an emergency, a provincial emergency, to be called to accomplish. These are things we can all do. We can work together. We can be collaborative. We can raise awareness. And we can continue to take the important steps that our government has been taking. Mr. Speaker, none of us want to see any more lives lost. And so I look forward to continuing to work with my government colleagues, to work with members across the aisle, and I look forward to hearing them give their vocal support for important services like safe consumption sites as part of harm reduction and part of a comprehensive plan to address this issue in our province. Thank you.